Hello, everyone. Welcome to another episode of Tell Me About Your Dog. I'm Sam. I'm a licensed veterinary nurse here in the sunny state of Florida, a pet insurance advocate, and lover of all things senior pets. The goal of this podcast is plain and simple. Tell me all about your dog and what makes them special. I have a very special guest with me today. She is my former partner in crime during my time in the ER. She's the owner of Family Animal Hospital, a dog, cat, and chicken tamer, and seriously, one of the coolest cats I know. Everyone, please welcome Dr. Anna Bannon to the show. Thank you so much for coming on.
Thank you for having me. I'm excited.
Normally, I would just jump right into asking about your dog, but I do think you need a little bit of an introduction. So tell us about yourself first.
Okay. I'm a veterinarian. I've been a vet for 14 years. I first started in the vet field 23 years ago. So I've definitely made my life about animals and vet med. I opened a practice 7 years ago, and is a lot of fun. Very interesting, a lot of hard work. I'm sure we'll talk more about that in future podcasts. But yeah, I have chickens, I have dogs and cats. I love animals and have dedicated my life to it. So.
We love it. We love it. So Anna and I saw some crazy out of the box things during our time at the ER. Do you remember anything specific, any of the craziest cases that we saw during our ER time?
Oh, man.
I know there's a lot.
There's a lot. And that was a long time ago.
It was a long time ago.
That
was another lifetime ago, pre-COVID.
Yeah. Oh, yeah. I've been married since then.
You got married, yes. When I met her, the first day I met her, she had just gotten engaged. And then 2 weeks later, I saw you again and you got married.
That's right.
And I was like, wait, what?
Why wait? So I can remember the duck. We amputated a duck leg.
Yeah, I do remember
that. That was an odd one. We had the dog that got stabbed in the neck, and that did not end well. A family member was fighting, and the dog got stabbed by the daughter, and that was a really sad case. I think about that dog a lot. His name was Bannon. That was really sad. A lot of things are sad in the ER.
It does suck. I think more about the sad ones sometimes than the happy ones in the ER days.
Oh, the Frenchie C-section.
I was going to mention.
Yeah, that one was pretty cute because everyone did well and everyone lived.
Yes.
And
so the premise of that one, the dog came in. She had given birth to one puppy on her own.
Which is rare for a Frenchie.
Very rare for a Frenchie. A Frenchie usually needs a C-section for the entire litter.
Right.
But she delivered one on her own, and then we helped her go along to see if she would do the rest of them, and she ended up not. We had to do a C-section on her. Yeah. But I do remember she carried that one puppy around like a little piglet.
Because they look like piglets.
Because they are little piglets. So you started your own practice literally from the ground up.
Yes.
What were your thoughts as you saw the building starting to come together, the walls going up? What was going through your head?
What am I doing? That's what was going through my head. It was a very nerve-wracking time. I opened with my friend who actually opened a pet resort right next to my animal hospital. So it was really nice having her because when we had the moments of, we don't know what we're doing. We've never ran a business. How do we open this? We're Googling what paperwork do we need? And the craziest stuff happens when you're opening a business because the government's like, well, did you file this? Well, did you know you're part of the same group as hairdressers and you need this extra form? And every form costs money, by the way. And then the weirdest thing was we had the building, we were getting ready to get all the permits and stuff for it. And someone from the state was like, well, you need, what is it called? The lightning rods on your roof, like a lightning rod system on your roof. And I look around at the entire complex that we're in. No one has a lightning rod system on their roof. There's a 2-story kids daycare center right behind us. They don't have a lightning rod system on their roof. And I'm like, why do we need a lightning rod system on our roof? Which, by the way, cost $30,000. Nothing that I budgeted for. So
nothing like an unexpected 30 grand.
Yeah, it was a very unexpected 30 grand. So I fought it and I was like, I don't think we need this. So I called and my builder was like, no, you absolutely need it. So I called the state and I finally get someone on the phone and they literally said to me, well, you need a lightning rod system on your roof because dogs don't wear shoes. And that's why I had to spend $30,000 on a lightning rod system because dogs don't wear shoes and apparently kids do and humans do in all the other buildings. And so that was a very interesting time.
This just in, dogs don't wear shoes.
Dogs don't wear shoes. I was like, well, what if we made every patient wear shoes when they walk in the building?
$30,000.
That saved me every penny I have.
Shoes required in policy in my building.
Isn't that why? So things like that just popped up and were crazy. But
oh my gosh.
Yeah.
Now, you named Family Animal Hospital that because you wanted the aspect of the clinic to be family related. You wanted clients to feel like family.
Yeah.
And with the majority of clinics in the US being corporate owned now, how do you keep a variation between a privately owned practice like yours, where you're trying to stay away from the corporate manner? How do you differentiate? How do you keep it non-corporate?
So there's, like Sam said, there's a lot of push. Most vet clinics in the area are turning corporate. I think it's officially over 50%. And a lot of it is focused on how many numbers you can get in the door, what's your average client transaction. You need to see a patient every 20 minutes. And I just never liked that style of medicine because it's just always about push, push as fast as you can go, as many as you can see. And they don't really care about what's actually happening in the exam room.
Right.
I also spend more time at work than I do at home. And I spend more time with those people than I do at home. So the people that I work with, I consider family. And then my clients, I consider family, especially when you get to know them over a decade and you watch their puppy grow up and turn into a senior. And you're there for like the first appointment all the way to like their euthanasia visit. And so that's part of why I wanted it to be Family Animal Hospital and really get to the personal aspect of it because it is such a very personal thing. And I don't know, I stay away from the corporate aspect of, well, we need to meet these criteria and these are the numbers, but I don't look at numbers. I'm not a numbers person.
Mm.
And I often kind of joke like, I'm not sure how I run a business, but I can pay the bills every month. So that's what matters. But I'm sure if I got a corporate person in to like look at my P&L statements and all that stuff, they'd probably, think I'm not doing as good as I could be. But I don't care about that part. I care about the patients and having time with the owners and time with the pets because it's scary to come to the vet. Even for humans, it's scary to bring their pet into the vet. They don't know what kind of information they're going to get. They don't know what you're going to find. They don't know if their pet's going to leave for the day, when they're really sick and come in. So
yeah, exactly.
I wanted it to be a very like personal feeling.
Yeah. And like you said, you spend so much of your time in the hospital with your staff, seeing your clients. You want everyone to come in and not feel stressed about what I'm doing here. They want to say, okay, I'm in good hands because I know Dr. Anna, I know her staff, I know that I'm being taken care of because I'm like family to her. So I trust her.
Yeah, exactly.
That's a big part of it is building that trust factor.
Yeah.
And she's right. There are a lot of veterinarians right now that struggle with the fact of we have to meet numbers. We have to see patients every 15 minutes. It's become more and more of a standard almost. So having that quality time with patients is so important. And we take an oath after school that we provide the best of quality care. And I'm not sure you could get the best of quality care in 15 minutes for every single appointment.
Right. And then having to do medical records after and then calling lab results and then talking to clients who you're following up with a few days later. There's no time in the day for those things if you're just seeing 20, 30, 40 appointments a day.
Yeah. There's so much behind the scenes too that clients don't know that we have to do after they leave for the day.
Yeah.
Or what we have to stay behind, clean up, write records, get prescriptions ready, get things ready for the next day. There's so much behind the scenes.
I had a client yell at me once because it was about an hour before we were closing and something had happened with her dog and it needed like a suture or something. So we advised her to go to the ER. Mm-hmm. And she was very upset with the staff for like turning her away. Meanwhile, we were crazy busy in the clinic, but she didn't care about that. So she wanted to talk with me like a few days later on the phone. So I did the courtesy because I knew her well. I called her and asked her like, well, what did you want to talk with me about? And she was like, I can't believe that you would turn me away. My vet up north would have stayed after hours to see me. And my reply was, I already stay after hours for hours. I usually don't go home till 9 o'clock at night. And I cannot say yes to all 5,000 of our patients.
Right.
Like, you have to understand, if we could have seen you, we would have. But that's what people don't get. Like, they're like, well, just stay late for me. I was like, I stay late all the time anyway.
And we almost always stay for something.
Oh,
or
yeah,
through
absolutely.
lunch. We come in early, we stay late. There's never an end time I will promptly leave at 7 p.m. every single day.
What's lunch?
What is lunch?
What's lunch?
You guys get lunch?
We don't get lunch. I mean, I don't get lunch. My staff gets lunch. I'm very protective of them. I don't get lunch, but my staff does.
Well, that's great. As we all know, in Florida is a billion degrees right now. One thing we saw a lot of in the ER was heat stroke. Do you guys see a lot of heat stroke patients right now? What are some tips that you talk to clients about for keeping your pets cool in the hotter months?
Yeah, I even talked about this yesterday because what people don't get is like, oh, I won't leave my dog in a hot car. They'll heat stroke. But they can heat stroke on a walk. Mm-hmm. They can heat stroke just being left out in the backyard too much. Our last couple heat stroke dogs weren't anything traumatic, like they were forgotten about or anything. They were just going to the beach and they were running around and they didn't have a lot of, fresh water available or shade. And that night they just got really, really sick, especially if they're drinking some of the salt water. That was a case at the ER that we saw. And I don't think they made it.
That was a salt toxicity.
Yeah,
they had drank so much salt water.
Combined with like heat stroke. It was a horrible combination.
And it happened so quickly. I think every study or every lecture I've seen, it's 10 minutes. A dog can have a heat stroke.
Yeah.
Especially in this weather.
And so, I think our last one, the dogs were just outside in the backyard, just running and playing. And the owners came to let him in and one of them had already collapsed. And they did live, but they had to, after we stabilized them, they went to the ER for a couple of days.
Yeah. And it's scary. It's scary to see your dog go through a heat stroke. It's stressful for the owner. It's scary for the staff too.
And you can also kind of miss it because they're just panting, which they're panting all the time.
Yeah.
But the panting turns into like frantic panting and then like wobbliness and like it's sad and scary and happens.
It's a drastic change in panting to, oh, wait, this isn't just normal panting. This is, I can't catch my breath kind of panting.
And then their gums get really like red and dark because they're trying to cool themselves down. And
their stomach and their ears turn colors too.
Yeah. It's scary. Thankfully, we only see like one a year, which I'd rather not see that. But it definitely happens.
Yeah. I remember the ER days. It was like one a week at some points.
Yeah.
We saw it a lot because we were so close to the beach. People would come in from the beach if their dog was having a heat stroke because we were so close.
Right.
The other cool thing we saw once was a dog that got stung by a stingray.
Oh.
It was a 4th of July.
I don't remember. Was I there?
You were not there.
Okay. I was like, I don't remember that.
You were probably home enjoying festivities.
That's right.
Because it was 4th of July.
Okay, yeah.
But we had a dog come in from the beach, was out boating with the owners, and a stingray stung the dog in the armpit.
Oh my gosh.
And the barb was still there because they had heard from Steve Irwin's story about not removing a barb if you get stung by a stingray, because that's allegedly how he had passed away. And so they came in, the barb was still in the dog's armpit. So we did the surgery. The dog did fine, but it was crazy how quickly it happened. They were shocked at how 1 minute they turn their eyes away from their dog, and the next minute he's chasing a stingray and gets stung.
I bet the dog loved it though. Chasing a stingray?
Oh yeah.
So
it was a big old doodle.
Oh,
yeah, they're big goofballs.
Yeah.
Oh, so I do have a viewer question that I thought would be fun to answer together. And it's a pretty simple one, but the question is, after all the years of working in a vet hospital, what is one breed you would never own?
Ooh, that's a long.
You want to go first or do I go first?
I would go with Frenchie.
Frenchie?
Yep. I don't want to own a Frenchie.
I think I have I love them. I know so many that I love, patient-wise and friend-wise, but I would never own a dachshund.
Oh, okay.
I have seen way too many go down in the back end and have to have emergency surgery and have so many spine problems, little leg problems. And I have stairs. I don't know that I could do it with stairs. I would feel so bad just seeing them hop down each step.
Every time.
Every time. I agree with the Frenchie too. I love Frenchies. I think they're cool dogs.
They're very cute.
They're very cute. Very cute. We've seen a lot of them.
Unfortunately, humans have done a disservice to Frenchies. They're breeding them for color, not for health, not for good positive traits. We've seen a lot more mean Frenchies.
Yeah.
And you can't even muzzle them. They have to have this like Hannibal Lecter mask that goes on.
Yeah.
Because they can't, they can't breathe, they can't walk, they get neuro stuff like crazy, not just like spinal issues, but brain problems and seizures. And
you're right. I am seeing a lot more with behavioral issues too.
Yeah, right?
All right. So you know what I'm going to say now, because it's pretty much the premise of this show.
Let's talk about my dog.
Let's talk about your dog. You had a very special dog that was your sidekick for the last 14 years.
Yes.
Tell us about your dog.
Okay. I'm going to try to get through this without crying, but it's probably not going to happen. So Chai was a Doberman. And she was a very special Doberman because she was white. Technically cream colored, but they call them white Dobermans. The first time I met her, I was a senior in vet school. And I was walking into one of my externships and she was in a kennel. She was only about 6 months old. And I looked at her and I said, "What the hell is that?" Because she was weird looking. Like, she kind of looked like a Weimaraner, but she was a puppy. She was like 6 months old. So she was kind of weirdly disproportioned. and an odd color, like really the color of these walls. Well, okay, that wall. Um, and someone was like, "Oh, that's a white Doberman," and I was like, "I've never even heard of that." And apparently, it's a thing. It's an inbred thing. They're technically like half albinos, but she
Mhm.
had blue eyes and just very like peachy nose and like
The pinkest of
creamy.
pink.
Yes, the very pink nose. Um, and so she was at the clinic because she was a rescue and she kind of needed a home. And I was like, well, I've been dying to have a dog since I was a kid. And now I'm finally going to be a vet. And I wanted a dog. So I met her and I fell in love with her. And that day I adopted her and she was just the perfect dog. She was one of those puppies that like, if she did something wrong, you'd be like, oh, I can't believe you did that. And she would just be like, I'm so sorry. And she would never do it again. And
Aw.
so she was the easiest puppy to raise. And she was so sweet natured. I had cats at the time and she never had an issue with cats. She would just sit there while they smacked her in the face. And that was about it. So I got her when she was only 6 months old. And she had a lot of Doberman issues. She had von Willebrand's disease, which is a bleeding disorder. Later in her life, she had copper storage disease, which is a liver disorder. She had melanomas. She tore her cruciate, probably both of them. So she had a lot of medical issues. But when I adopted her, knowing she was an inbred dog, I was like, I'll be happy if I just have her for a few years. Like she might not live a long time because she's not in great health.
Right. And what better mom than a veterinarian to handle all these issues?
Right. And she lived almost to 14 years old. And
That's
I
amazing.
feel so fortunate that I had her for that long. And she was just a really great dog.
Yeah. And she went with you pretty much everywhere
Yeah, she
for a lot of her life.
Yeah, she went to work with me all the time until she was older and she didn't like it as much. And but yeah, she was always at the ER with us and she would hang out like in the treatment room with all the sick pets. She would just be laying there and
Clinic supervisor.
Yep, clinic supervisor. There was one family that came in and we had euthanized their dog and they had 2 little girls and the girls were just beside themselves and they went and hugged Chai and they were like laying on her and hugging her after we had euthanized their family dog. And it was very sweet. And I was like, Chai was a very special dog.
She was. I do remember every time we had a euthanasia at the ER, if Chai was here, same situation. We were like, oh, can we have a visitor come in? And she was literally a little visiting angel. She would walk in all dainty and very slow, she knew something sad had just occurred. She was very good at reading the room and she would just sit with people and let them pet her and love on her. And she was bringing so much comfort to people who had been through a really sad event.
Yeah.
She was literally a visiting angel.
She really was. She was a very sweet dog, very good natured, despite being a scary Doberman.
Disclaimer, Doberman are not scary.
Yeah,
they are wonderful. Are there any interactions from being out in public that stood out to you? Because Chai being such a unique looking dog, you had a lot of people approach you.
Yes.
Are there any interactions that stood out?
Someone stopped their car on the road, like a road. They stopped in the middle of the road to yell over to us. We were at a brewery in St. Pete and there was even a fence. So they saw her through the fence and they stopped the car and they yelled, what kind of dog is that? And that happened a lot. That was not the only time people yelled at us from their car about Chai. We were walking in like an outdoor outlet mall and someone came running from across the parking lot. And we were like, oh gosh, something's happening. And they ran right up to us to see Chai. And they were like, what is this? And yeah, so a lot of people would stop and ask, even we had a rental house and someone stopped in front of the house and we were out front with her and they yelled, is that a statue? And then she turned and looked at them and they were like, oh my, what is that? And so it was always fun. My husband said it was like a celebrity going out in public with her because everyone would come and talk to us. And she was so sweet and kind that it was great because she would just walk up to people and get her scritches. And
I do remember someone we were out at a brewery once saying, she looks like that statue from Friends.
Yes.
The dog statue that Joey had. It looked like Chai.
Yeah.
It did.
Oh, that's funny.
So unfortunately, Chai is not with us anymore.
Nope.
When did you start to see a decline and start to know I need to consider?
Like 2 years ago. So I euthanized her in December of this year, which was only 5 months ago. And it was like probably a good 2 years before that we started talking about quality of life and stuff like that. And I was just very fortunate that I was in a position where she could either come to work with me or my husband's a substitute teacher. So he also had the freedom to kind of pick and choose his shifts. So when it came towards the end, like he was able to be home with her more when we needed to. So I feel like most humans that worked jobs where you can't bring dogs, and she wouldn't have made it as long as she did. But it was a couple years ago that her joints were starting to be an issue. She was on a lot of medications for pain, for her liver. She had a lot of UTIs that were just chronic, recurring. She got pneumonia 3 times in the last year of her life for no real reason, just popped with pneumonia a few times. She started collapsing near the end, and but it was so hard because it was such a long, drawn out issue. Sometimes owners, when they have a pet that's like diagnosed with cancer and they only have a few weeks to live, and sometimes we're like, well, at least it was a shorter process. Like you didn't have to watch them suffer for so long. And I definitely can see how it's difficult to watch them age over a long period of time. But at the same time, I felt very honored that I got to watch her age, because not a lot of people get to do that. And a Doberman living to 14 is very unheard of.
Yeah, especially with all the issues she had.
Exactly. Like I even had, I met a breeder once that bred poodles and Dobermans, and she told me Dobermans don't live past 10. And I was like, my Doberman's 12. And she's like, well, you're a vet. I'm like, what does that have to no, like Dobermans can live past 10. And the fact a breeder would say that, breeders should be a whole nother show.
Breeders will be a whole nother show. a whole nother topic.
So I felt very, very fortunate that I got to watch her age, not gracefully, but watch her age, and that we had the ability to take care of her. But I remember like last Christmas, I was like, all right, family, this is her last Christmas with us. And she actually made it till the next Christmas. Aww. So I feel very fortunate about it.
Yeah. Well, you gave her a really long, great life that she definitely wouldn't have had if you hadn't adopted her that day.
Yeah, exactly.
Because she's been with you through literally everything.
Yeah.
Oh, well, Anna, thank you so much for coming on the show. And thank you for sharing Try's story. She had a really great long life, and she was lucky to have you as her mom.
Oh, thank you so much, Sam. I love talking about her and talking about vet med. It's obviously a passion of mine.
Of course. That's what we're here for. Yeah. We are not in it for the money, contrary to popular belief.
Yep. On my $30,000 roof system.
Yes. The lightning rod that cost $30,000 says differently.
Yeah.
Well, thank you all for listening. Please be sure to follow the show on Spotify and YouTube, and follow Tell Me About Your Dog podcast on Instagram, where I would love to get your DMs and hear about your dog stories and any topics you'd like to hear more about. Until next time.